one cause of death in the United States is heart disease. Most cases of heart disease are the result of plaque buildup in the blood vessels that feed the heart. If the blood flow feeding an area of the heart is interrupted, that part of the heart will die. This is what a heart attack is. Let's start from the beginning. You have arteries that feed all the organs in your body. Whether it's your kidneys or liver or heart or brain, all organs need to have blood flow to sustain the life and function of that organ. All arteries have three layers: a thin inner layer, a muscular middle layer, and a fibrous outer layer. The inner layer acts as the front line in keeping the artery healthy. This layer secretes chemicals that allow the arteries to dilate and constrict as needed. It also secretes chemicals that work to keep everything in the blood moving easily through. Unfortunately, there's a bad guy in this story that does occasionally slip past the inner lining into the muscular middle layer. The bad guy is called Ldl cholesterol. LDL is particularly able to invade the inner lining when the lining has been injured by high blood pressure, smoking, or high blood sugar. Well, what's cholesterol? Cholesterol is an essential part of the cell membrane, and it's used as a precursor in making numerous hormones. You can get cholesterol in your diet, but most of your cholesterol is made by your liver. Saturated fats and trans fats particularly drive the production of LDL. LDL is what's referred to as the bad cholesterol because it promotes the buildup of plaque. HDL is referred to as the good cholesterol because it pulls LDL out of circulation, so it helps to prevent plaque buildup. The process goes like this. First, the cells of the inner layer become injured. This may be from oxidized LDL, or smoking, or high blood sugar, or high blood pressure. Once the cells become injured, it's much easier for the LDL to slip past the inner lining into the middle layer. When LDL slips past the front line, a chemical alarm bell goes off, announcing the presence of a foreign invader. The inflammatory system, acting as the police, becomes activated and rushes in to save the day. Although the inflammatory system is trying to help, it creates a bit of a mess. It forms a soft, mushy plaque right over the area where the LDL has invaded. This helps to contain everything, but the area becomes a hotbed of inflammation. Sticky platelets are part of that inflammation. Over time, the soft, unstable plaque will form a hard, fibrous cap, but in the early stages, when the plaque is soft and unstable, there's a higher possibility of plaque rupture. This is the cause of 75% of heart attacks. In plaque rupture, the side of the artery where the plaque breaks off attracts more inflammatory cells and sticky platelets. This promotes clot formation, which can completely cut off the blood supply downstream. Now, realize that this process can be acute, as I just described, or it can go on for years, where new plaque is laid down on top of old plaque until the artery is only able to let a trickle of blood flow by. Sure, there are some things about this process you can't control. You have a higher risk of heart disease if you're a male or have a family history of early heart disease, and the risk also increases with age. But there are a lot of things you can do to prevent heart disease. Well, what are they? First, do not smoke. If you do only one thing for your health, make it be smoking cessation. Smoke is extremely irritating to the inner lining of the artery and dramatically accelerates the process of plaque buildup. Smoking cessation can significantly reduce your risk of heart disease. By the end of the first year, your risk is reduced by half, and after 15 years, your risk is equal to that of someone who's never smoked. Keep your blood pressure less than 130/80. The lower the better. Several recent studies show the risk of developing heart disease starts to rise above 115/75, so think low. To lower your blood pressure, lose excess weight, exercise, minimize salt, and avoid excess alcohol. Take medication if needed. Keep your blood sugar normal. A diabetic's risk of developing heart disease is proportional to how high the average blood sugar is. The goal for everyone's blood sugar is less than 100 when you're measuring first thing in the morning after a 12-hour fast. Keep your LDL cholesterol less than 130, preferably less than 100, especially if you have diabetes. And if you have known heart disease, you need to keep the LDL less than 70. You can do this through reduction of body fat, regular exercise, and diet. Your diet should be low in saturated fats, trans fats, and cholesterols. It should be high in fiber and unsaturated fats. You need to take medication if you were simply born with a liver that's too good of an LDL production factory. Keep your HDL cholesterol above 40, preferably above 60, through exercise and reduction of excess body fat. Smoking cessation will also raise HDL. Keep your triglycerides low. A high triglyceride-low HDL ratio is associated with an increased risk of heart disease. Triglycerides are the main form of fat you eat and the main form of fat you store in your body. If triglycerides are high, it's usually a sign of elevated insulin, which indicates poor blood sugar control. Smoking and excess alcohol will also raise triglycerides. Be a lean machine. Obesity itself is considered an independent risk factor for developing heart disease, particularly if you have fat accumulating around the waist. Be physically active. A regular exercise program significantly reduces the likelihood of developing heart disease and reduces overall mortality. Maintain a healthy diet. A heart-healthy diet is high in fruits, vegetables, whole grains, and fish. You want to minimize red meat and dairy products, which are high in saturated fat. Most of the fats in your diet should come from unsaturated fats, omega-3 fatty acids or polyunsaturated fats that appear to be particularly healthy for the heart. Foods high in omega-3 fatty acids include fatty fish like salmon, soybean, walnuts, and flax seeds. I'm also going to mention moderate alcohol consumption because I'm sure you've heard about this helping the heart. But the important thing to emphasize here is the word moderate. Men should have no more than 2 drinks a night on the average, and women should have no more than 1 drink a night on the average. Alcohol in moderation can help the heart by increasing the HDL cholesterol. It can also thin the blood, but too much alcohol will negate those healthy benefits by adding other health risks. Good stress management skills are also helpful in protecting your heart and blood vessels. Stress is associated with a higher rate of heart attacks. Get a healthy night's sleep. This is important for the heart too. Well, to sum it up, there are many things you can do to prevent heart disease. Lifestyle measures can make a big difference. If you don't know where you stand as far as some of the risk factors we just talked about, make sure you talk to your doctor to find out. You definitely want to take the reins on this one.